Okay, so yeah, so this one, I think it was not my title, it was their catchy title, How to Win a Hackathon. So I guess I will take some of the proceeds if you win. I just had to fill out my ethics questionnaire. I don't know if I had to declare that or not. But anyway, if you're going to participate, you might as well win, as we say. And so I'm going to talk a little bit about hackathons, which I think is a very common and perhaps overused term as well. And then at the end, we'll talk a little bit more about the health equity hackathon that's coming up. I just got back from a week in Oregon, so I'll share a picture or two as well. Had a great time out there. So first of all, as you guys know, this is kicking off Research and Education Week, where parts of it are back. I see some things are virtual, some things are in person. Particularly, I took this picture of the board that's up in the near one of the halls there, which shows all the different events. So definitely try to participate. I know there's going to be poster sessions from 1 to 3 p.m. each day. I think the poster sessions are a great time to walk around and see what else is going on research-wise at the hospital. So I think please take advantage of the events this week. And maybe it's good we're going early on the week before people are fatigued out from all the events of the week. All right, so what is a hackathon? Again, I think it's almost like we say in medicine, the word protocol, which means many, many different things and can apply to many things. Hackathon has been kind of overused, but I think the idea is they say a sprint-like event. So the idea kind of in modern software engineering of sprint-like is, you run quickly to the finish line, you prototype early, you fail early, and then you kind of iterate and improve your design. So most hackathons do have a goal to create some functioning software or hardware, typically in a short time period, like a weekend or, even an afternoon event. And they usually have a focused area. So here's a nice picture of the cherry blossoms for those who made it down. That was probably about 2 weeks ago when they were in full bloom. But that's my definition of a hackathon. You can go to Wikipedia, the source of all knowledge right here, where they expand upon that. So here's the hackathon. There's many. You just search the web. This is Blueprint from MIT. So how many people have participated in a hackathon? Why don't you type in the chat, at least if you participate in the hackathon right here, and what hackathon event that was. Go ahead. This is the audience participation part, by the way. You get brownie points. So someone get the ball rolling and tell me some hackathon they've attended. Anyway, this MIT one here, again, you can go weekend long. So it can be virtual and in person. They even call this a learnathon. So hackathons can be an engaging event that well too as well. And usually you can sign up as an individual, and very often they form teams right here too as well. So it's very common for hackathons. It's a way to bring the community together. It's nice to be in person, but I think virtual hackathons, just like we learned, virtual presentations have their advantage, that people can zoom in from anywhere. There was an event that we had participated in called George Hacks event at George Washington University. At Children's, of course, we start everything with bear, bear this, bear that. I guess at Georgetown, they do the same thing with George, perhaps, right here. But this is just from their website. Where it's a student-led nonprofit, and they've done this the last couple of years to empower the next generation of change makers. And I think hackathon is kind of synonymous with innovation as well. I think that we have our Sheikh Zayed Innovation Institute that I run the engineering side of on the 6th floor of the hospital. And, we all know the world is changing and technology continues to evolve. And technology continues to have more of a role in the next generation of medical care and the other issues, as Patrick mentioned, with health equity. So I think hackathons are, in a sense, innovation competitions right here. So how do you take, particularly for students, what you learn in the classroom to real world issues, develop teamwork skills. We know that people are always work in teams nowadays. We don't work in silos, and improve communications of ideas. And in this one here, most people associate hackathons with coding, and you need to learn to code or write software. Not necessarily true. That event, they may have projects that may be more hardware based. It may be come up with a design. They just had an event at the end of February too that went out very well. So there are opportunities in the local area for people to participate in hackathons. We did sponsor 3 hackathons by the CTSI-CN. So in 2017, it's hard to think right here. These were all pre-pandemic, so I don't know about you, but I kind of divide my world now into pre-pandemic, during the pandemic, and I'm not ready to say post-pandemic yet right here. Sure, I'm sure right here, but hopefully we're pulling out of things, and we'll have a chance to get together more in person. But these events were in person. They were at the GW Milken School of Public Health. And the way this worked, and you can see the flyer on the right, was, if you have an idea for a medical app, and of course, apps are everywhere. I'll show some of the apps that we had developed for the iPhone later on. You would submit the idea, and we invited 10 teams. You could have a team, or you could come as a lone person and ask us to help you form a team right here. So for that one, we almost got 50 ideas for the first time we did it. And then we kind of vetted, wanted to see, what was the level of innovation, what was the impact, maybe what was the ease of implementation. But 10 teams were invited. We had about 50 participants. It was on a afternoon session here. And the way it worked is people got together. They kind of designed their app, in a PowerPoint type presentation. There were judging criteria. They presented to the group, and the judges selected the top 3 apps. And then those top 3 teams were given assistance to develop apps. Now, unfortunately, it turned out we developed a lot of apps that later were not used as well, too. So I'm going to add to my list of winning a hackathon, which I will share the slide at the end that tells you how to win the hackathon, persistence. But I think that's true in research in general, is that persistence is key. These were the hackathon project titles, and this slide is a little boring right here from 2017. But you note that the project descriptions are really all over the map. So there's predicting baby weight right here. There's physical therapist, pediatric stroke scale. That was with Paula Pergami actually some time ago right here. Here's one already on social determinants of health. That could even fit into the health equity theme right here. Diabetes app. And, I think, we live on our phones nowadays. And, I say on my trips, what do I need? I need my cell phone. It's got the app with my tickets, got my rental car app, got my Airbnb, everything in here right here. So, I think the idea, of if you have an area you're working in, that eventually there probably is an app in your future right here. You'd say, wow, wouldn't it be convenient if I had all that on my phone as well? And of course, with the phones being able to pull from the web, the cloud nowadays, right here, all kinds of resources. You can imagine that, an easy to use app in whatever your focus area might be a very good way, both for you, for clinicians and for patients as well. So that was the idea, and with these different apps here. Now we did, that's the judging criteria. Oh, there's my family picture. So here we are at Mount Hood at the winery in Oregon last week. It was quite nice view there, but these were the criteria that were used. And, at the Health Equity event, it will be a little bit different, but I think it will be similar. So first is clinical importance. And I always say, that's the most important thing for anything we do as researchers, and those of us who go after NIH grant funding know as well. The first thing, is it clinically important? Can we, convince people of the significance? And then, of course, I think level of innovation. We're always looking as what's new in the field, what can we do differently? And then for the hackathon itself, it was the quality of the pitch. How well did the team? Finally, the ease of implementation. It is important. Is this something that can be implemented in a short time? That's not a multi-year project, that will require a large professional development team. And then finally, the participation and the mix of the team. I'll talk later on about how important it is to have a varied and multidisciplinary team, I think, when you do these events. Okay, here's some of the example apps. And if I didn't put your app up here, sorry about that if I missed one right here. But this one on the left here, just to show you the different, this was done with a bunch of GW Med students who had created the DC COVID Connect website. You can look it up. And then I listed the last names below. I think I got them right. But one of them I pointed out, Alex Lynn, who was a student at TJ High School. So, to me, one of these kind of overachievers right here, in a good way right here in high school, who developed the app with our programmer, is Hadi Fuladi Tulari is our programmer right here. And this is now live. So you can find this one on the App Store right now. And it's kind of, it basically mimics the website, but is a user interface. And I'm hoping that Dr. Rucker and her colleagues in the emergency room roll this out to the patients soon. The middle one was done with Anuma Sheth, who is a epilepsy. I'm trying to remember her clinical specialty. A George Washington University doctor who won one of our app competitions. Who wanted an app for women who have seizures, and it has to do with tracking their periods and how that relates to their seizure cycles. And this is in clinical trial now at GW. And this was Eleni Sampley is one of my other software developers. Sorry, misspelled the last name, I see. But she worked on that app too as well. So the trick not only is to getting an app out, is to actually getting the app used as well too. And then finally, the one on the right is Bear Canal. There's your obviously a children's app right here with Dr. Preciado. And what this was, and his clinical colleagues, was that kids who get cochlear implants, there's a number of steps they have to go through to get the cochlear implants. And those are kind of listed at the bottom right of that app, a little hard to see. And this app also had we call a client side, a side where the clinical people could kind of put in the progressive steps and would help them track their patients and how they progress. So again, this was rolled out clinically and is now in testing under IRB. So in a sense, the app is just the beginning and is a platform for you to develop, your ideas further. And again, we do have some software expertise to develop these apps too. Provided, of course, you can find some funding. Always the caveat in research, right? Do you have money? We always joke. Okay. All right. So this is the slide here that tells you how you're going to win right here too, since that was the advertising. First of all, I think like in any grant competition, we say, pay attention to the rules, make sure you know the rules, and then make sure you know the scoring criteria. And then here I had written, join a well-rounded team. I had gotten some edits from Lisa Gway Woodford and from Chaya Murrow too as well, that said, I know for the health equity, they can put together teams. You don't have to have your own team going in. But I think it is good to have someone who knows a little bit about software, and how software is created. Maybe someone who knows a little about human factors, which is hard to find. I think we're all familiar with the overcomplicated user interface. When we can't work our TV or smartphone right here, we're like, wow, I wish this was simpler. And then, of course, the clinical expert, to me, the clinical expert, or you could even say the domain expert, again, if we broaden it to the health equity theme, it could be the domain expert, but you want people with different viewpoints. And then if it's actually an event where there's going to be a pitch, it's all about how you come off as a pitch, and some people present better than others. So I think that's where it's to start your presentation early, practice your pitch. Make sure the judges, who probably have a score sheet to fill out, can see all the elements, that they need for a score sheet to work you well. But then I think consider this a learning experience. I think this should have fun. So anyway, if you win, just remember where you heard this right here, and you can send me a portion of the receipts right here. Okay, I think the last slide here, and I'm happy to talk about this. And I don't know if Monica is still on, because I can't quite see all the participants. She might be able to chime in as well. But let me at least kind of go through it. And then Patrick, maybe you or Monica, if she's still on, can chime in a little bit. So here's this inaugural hackathon event for the Health Equity and Research Unit within Children's. And again, if you have an innovative idea about how a healthcare app can address inequities, you can pitch it here. You can see down at the bottom left, there's a site to run. To register your interest, a questionnaire. If you haven't been over to the Research and Innovation campus with JLabs, it's very cool. They have parking. Okay, I understand there's now food over there too as well, a food vendor right here, right off George Avenue there too as well. And Patrick I see pasted the registration link in there too as well. And so it's kind of a two-part competition, where you said maybe the first 2 weeks in June, you're going to have a competition for the best app idea, and then actually try to build the winning apps right there. And I think that's the key, is how do you translate what you want to do to practice? So with that, I won't keep you all too long today here. Those are kind of my thoughts. I'm happy to answer questions. I guess, Patrick, let's ask you if you have anything else you want to add about the hackathon. And then if Monica is still on, if she wants to comment, I will go ahead and stop my share right now. Thanks for your
Sure.
attention.
Thank you, Kevin. That was really that was great and informative, and I feel like I know how to win now. So I feel like that's very important. So for everybody, just to fill in some of the gaps with regards to the event that we're planning. So we're planning it, as I mentioned, for it's going to be held on a Saturday in one of the first 2 weekends of June. That'll be finalized in this next week. It'll look similar to what Kevin was talking about with the George Hacks, where it will be an app-based idea that will be we'll send out information about that solicitation. So that application process will open shortly. And before that happens, the interest survey that I just put in the chat and that we also put in the last slide there, we'd love if you could fill that out, because that involves, we're trying to get a little bit more feedback about the final themes that we should have, and some of the other pieces of the hackathon that we'd love your input on to make sure that it's responsive to our community, and that everyone who's involved feels that they have some skin in the game. So if you could fill that out, that would be wonderful. Give us a little bit more info and a little bit more to go on for finalizing the final pieces of this hackathon. But so that interest survey that I mentioned, so if you could fill that out, then we'll send out submissions for the health app ideas. You can do that individually, or you can submit with a small team. And then after that, if you aren't planning to submit and you don't have any app ideas, that's totally fine. We'd love also for you to come and participate just as a general participant, which is what several other folks, I'm sure I'll be doing that, and other folks who, we need a variety of expertise and a diversity of thought and experience to make sure that we've got the knowledge and the experience to develop well-rounded app ideas, and to kind of clean up some of the potential complications with any app ideas. So, and in June, we'll also be sending out in May, we'll be sending out the call for general participants. So if you're interested generally, please join us, and it'll be it'll be a lively event. There'll be a lot of expertise. There'll be a lot of potentials for collaborations, and the collaboratory itself is a lovely space. If you haven't had the chance to be there yet, it's like it's a place where you feel like you're really on the cutting edge. And we will, yes, we will have lunch provided and refreshments, definitely. And then we just think it's a great idea a great opportunity for you to collaborate, and for you to get some of your thoughts and passions around health equity heard and utilized to advance some and make some progress in this field. So